It is Monday. It is about 1:30 on the East Coast. Technical difficulties. You know how it is with technology. So I am here. Today is the first day of December. Listen, December is not the last month of the year. This is your last lap, right? So make it count. Be brave, be courageous, be intentional how you end 2025 so that you can start in motion with 2026 instead of starting over. Sorry. So today I am going to talk about a topic that many people probably never thought of, right? So my name is Daniella Noel. For those who do not know me, I am a licensed financial broker. I reside in Florida, but I am able to work with clients in all 50 states, including Canada and Puerto Rico. So wherever you're at, you're not limited. You can call, or you can DM me with your questions, and then I can serve you. So as a financial broker, I started in the insurance industry about 4.5 years ago. My background has always been insurance. I've always been in healthcare, specifically in the finance department, in accounting. So my background is accounting and finance. So 29 years, I spent 29 years in healthcare as account manager, and 23 of those 29 years were spent in the nursing home arena, long-term care, right? Some people see it as retirement home, nursing home, rehab center, but they are mostly long-term care facilities, right? You have some big, you have some small, you have some medium. So when it comes to this topic, I am well versed and I am qualified, right, to talk about this because I've spent most of my career in the long-term care space, skilled nursing facility, right? So again, nursing homes, assisted living, or in-home caregivers, it's not something that is easy to talk about because we see it as end of life, just like life insurance. When you hear life insurance, you think you're dying, right? So, but you're not. It is a conversation to have. I've been on this mission, on this campaign rather, about financial literacy for the family. Again, it is a hard conversation, but a conversation to have because unless you really want to die young, we're going to get old, right? We are going to get older. About 70% of the age population end up in a nursing home. But how do you prepare for that conversation? Can you prepare for that conversation? Of course, just like everything else in life, you need to plan for it. So this holiday season, a lot of families are gathering together, kids, grandkids, with parents. So this is the perfect time to talk about this, right? Okay, mom and dad, where do you want to live? Do you want to stay in the house? Do you want to go into nursing home? How are we going to pay for it? Yes. How are we going to pay for it, right? So when a lot of people here think that Medicare going to cover for your long-term care in the nursing home. If you have a skilled nursing where you require so many hours of nursing care, Medicare will pay for it. But once you plateau, you're not progressing, and you become long-term, you have to look at alternative means, right, of paying for your care. Now, if you are advanced in age, whether you have dementia, Alzheimer's, or you cannot care for yourself, you don't have to go to a nursing home. You can stay home, right? But it's a matter of planning. And in deciding to stay home, you have to decide the impact. right, is going to have on the family. Because it is not easy to care for an elderly. Yes, you may have multiple kids, they may take turn, but still, it does impact the family as a whole. So again, you have to think, when you get older, how is your family going to care for you if you cannot care for yourself? Yes, you have health insurance. Health insurance pays so much. If you have a Medicare replacement plan or you have a HMO plan, actually the HMOs are worse. Many times I have people come in post surgery, right? They're coming in with 30 days of rehab, and I had to fight. I'm constantly appealing the insurance companies to give my clients more days, because guess what? Unfortunately, guys, the insurance industry, as much as I love it, but they're not for you. It's a business, so they want to keep as much money as they can in their pockets. So they don't want to pay for your health care. That's why you, as an individual, you have to set up your own private, right, healthcare plan. And the same thing goes for long-term care. Same thing goes for long-term care. Sorry. Long-term care. So, who may need a long-term care? We're not only talking about someone who's old, advanced in age. I've had patients as young as 30, because life happens, things happened, a injury, a fall can make a 20-year-old or a 30-year-old quadriplegic. So you, at that time, it's really hard to keep that person at home. If you need a Hoy lifter to move them around, to lift them, you need extra help. And a lot of times families, right, whether they voluntarily or involuntarily, have to turn those family members to a nursing home where aides can really help them, right? So now you have to think, if you don't have a plan in place, your savings, can you imagine how quickly that would be depleted? Because guess what? Yes, Medicare pays for some if you require skilled nursing, meaning that if you have a wound, if you have so many hours of physical therapy, if you are on antibiotics, right? If you have a PEG tube, if you have a G tube, right? So those are skilled nursing. You require so many hours of an RN, of a nursing, not a CNA, of a nursing care. So Medicare will pay for those. Even that, Medicare has a cap. In the nursing home, they will pay your first 20 days in full. Days 21 through 100, they have a cap of 100 days, right, per illness. And you can reset the 100 days, but if you use your first 100 days, you have to wait for 90 days for that to reset, and you have to have another incurrence. You have to have another 3-day hospital stay. So Medicare does not pay for you in the nursing home facility long term. They only pay so much and for so many days. So if you have savings, you have to use your savings to pay for your care. Even the copay, days 21 through 100, there's a copay, right? Every year it increases. So you need to have money to pay for your care. Hi, Max, how you doing? You have to pay for your long-term care. So again, you may have money. Now, people say, hey, the government is going to take care of me. Medicare is not going to take care of your long-term care needs. The government, they may, but there are conditions, right? You have to be destitute. Your income cannot be no more than $2,000. All total assets, right? You cannot have CDs, you cannot have crypto. And believe it or not, people like me, when you come in my nursing home and you're gonna stay, you going to stay long term, I have to qualify you for Medicaid, because a lot of people think, oh, the state is gonna pay for my care. Yes, they may, if you are destitute, if your total assets are less than $2,000. So you cannot have over $2,000 worth of assets, in order to qualify for Medicaid. So you cannot have a home unless, right? Sometimes some stipulation depends on the level of care of the person. The doctor may say, hey, this person will return home after a year or so. But if the doctor gives you a level of care where it says that you cannot return home in 12 months or less, guess what? You have to sell that house. One thing I hear people say, oh, the government going to take my house. The government is not in the business of taking people's houses, right? So they make you sell the house and you have to spend down. Now, is there a way to avoid that? You worked hard for your house, you want to keep it for your family, you can. One way of avoiding having to sell your home is by having a trust. Remove the house off of your name by doing a quit claim deed, right? And put it in a trust. And now you have to be careful. If you have what is called a look back period. 5 years. Sometimes they go back as 10 years. We're going to request your bank statements. The first thing when somebody comes into my nursing home and we determine that you need long-term care, I'm going to ask you for the last 3 months bank statements. And I'm going to go through those bank statements with a fine-tooth comb. I'm going to question every transaction, right? So you cannot be transferring money to your family thinking that, okay, let me spend down. No. Many times I've had to have family return the money because if it falls within the 5-year look back period, you will not qualify, right? Things that you need to be mindful of. Some people have burial policies. It needs to say irrevocable. So check if you have a prepaid funeral plan and check to see if it says revocable or irrevocable. So if it says revocable, that means that you can cash that. Again, that would put you over assets. So what I have to do, I have to find you a nursing home, a funeral home, right, to modify the prepaid funeral plan for it to say irrevocable, because the state will not qualify you for Medicaid if there's any hint of money. Another thing people may not take attention or take into consideration. Again, when I'm reviewing your bank statements, I'm looking for life insurance. Yes. So I'm looking for pension, right? So to account all of your income. So if there's a life insurance, I need a copy of that life insurance. And guess what? If it's a cash value, as much as I love and promote cash value, but if you are in my nursing home and you have a cash value insurance, guess what? You have to cash that. You cannot keep that. Again, find ways. There are ways to avoid those things. That's where estate planning come in, right? You don't have anything on your name. That's the best way to avoid the not being qualified for Medicaid if that's what you choose. But guess what? You're a hard worker. You worked hard. You build your savings. You build your account. You can pay for a long term, right? But if you are one that think that you may need the state to pay for your long term care, right? Depends on what state you live. So, and I'm going to talk about that later on. So if you live in a state where the state will pay for your nursing home, you cannot have anything on your name. The home cannot be on your name. The life insurance cannot be on your name. It needs to be in your trust. Again, there are ways around it, but if it's on your name, it's you, it's yours, you are the owner, guess what? It will prevent you from having Medicaid in your state. So the reason why I say depends on what state you live. So there are many states that I have set in place for their residents to have their own long-term care. Washington State is fully, they charge their residents a tax, right? So that they can carry their own long-term care. And other states that have looked into it, California, New York, Texas, right, is talking about imposing a tax so that people can carry their own long-term care. And you may say, okay, why is that? Because it costs the state a lot of money. It is a big expense for the state. Let me tell you, the last company I worked for, they have 240 nursing homes throughout the state. Guess what? On an average, for Medicaid alone, I was collecting anywhere from $1 million to $2 million a month, not a year, a month. So imagine how much the state is putting out for long-term care. So it is a cost that they can choose not to pick up. Again, we are individuals. Nobody's going to save us. You need to have things in place to save you. Again, if you find yourself in a nursing home, you have to deplete your savings. You have to deplete your retirement, right? And you cannot keep your home because it's an asset. Again, your assets cannot be more than $2,000. If you are married, right, yes, you can keep the home. And there's so much money they allow for your spouse to keep. Again, you're coming to them for help. You need to be dirt poor. So how can you avoid, right, falling into that category where you have to depend on the state or you have to deplete, your savings, your retirement, you have to become destitute? Guess what? You can have your own private long-term care plan, just like you can have your own private retirement plan or pension plan. You can have your own independent long-term care plan. So again, it is through life insurance. So let me tell you guys, so I come all the way here to tell you how I got in the industry. So 23 years in the nursing home arena. Every now and then, probably once or twice a month, I would get a client who walk into the nursing home, very confident, they're pushing their little walker to my office, because when you come in within 3 days, I'm at your bedside asking you, what's up? Where's my money? What kind of insurance you have, right? So, because my primary job in the nursing home was to reduce bad debt. So if I can't collect it, it becomes a bad debt for the company. And I really watched for the bottom line of the companies. I was a beast. I was bad, right? They didn't like me because I had no shame in asking for my money. So I don't care. I give you 24 hours, and within 72 hours, I'm coming to your room and I'm going to tell you this is what your coverage are and how do you plan to pay, if you have out of pocket, or if there's any hint that your insurance is ending because you're not progressing, we're expecting you to be there for a couple of days. Okay, what is a long-term plan? Okay, how are you going to pay for this if you should stay here? So every now and then I would have, clients who come to my office, say, hey, I have a long-term care plan. I need you to file my claims. Okay, whatever, file the claims and got paid, right? So every month I didn't have to go knock on their door. I don't have to go call their families. Like clockwork, my bills were being paid by a long-term care company. And those long-term care companies were Transamerica, John Hancock, Nationwide, AIG. Okay, I didn't pay it. It didn't dawn on me what really those companies were, because it would have never crossed my mind that was a life insurance, right? When you see Nationwide, you're seeing car, home. So it wasn't until I sat down with an agent that I was getting a policy for myself. And I wanted to leave term behind, wanted to get something, that would last when I bought my house. And I wanted something, that can give me a little bit more benefits. So the agent was telling me, yes, this policy, if you get sick, it can pay you if you have cancer, stroke, heart attack. I said, what do you mean? Right? So so that's what we call living benefits. So that's how I learned about living benefits. Again, I was in the arena for 29 years, 23 years in a nursing home. I never understood, never knew about true living benefits. And then when I questioned her, I said, okay, long-term care, what do you mean? So yeah, if you're in a nursing home, it will pay for your care. I said, are you kidding me? That's when I realized those clients that I was filing their claims every month was their long-term care plans that they got through a life insurance company like Transamerica, Nationwide, AIG, John Hancock. I said, oh my God, even though I had so much experience in the field of insurance, no one ever sat me down to say, hey, those are life insurance plans that you can have a rider that would pay for your care in the nursing home. Guess what, guys? Those plans, they do not only pay while you are in the nursing home. Some people, and I'm sure you guys know, some people who are staying home and getting private nurses, let me tell ya, they're paying out of their pockets. Their insurance companies are paying for their long-term care while they stay in the comfort of their home. Guess what? You can do that too. You can have your own private long-term care plan. Now, like with anything else, yesterday was the best time to get it. You can get a long-term care plan from the age of 18 through 60. 60, they think you're going to accrue the next day, they're going to give it to you, right? And of course, your health rating. So again, you can get your own private funded long-term care so that you can use when you need it, right? There are some that you can get. You can get some independent, standalone long-term care. But be mindful that some of those plans is use it or lose it. But you can get you a life insurance plan, right? Ideally a cash value life insurance plan, and you add a long-term care rider to it. There's a cost, but it's minimum, right? Probably the most I've seen, probably $10 a month for like $200,000-300,000 worth of long-term care. So now, when you have it as a rider on your cash value plan, guess what? It's not a matter of use it or lose it. You use it or you pass it on. If you never use the long-term care plan, then it is added to your insurance, right? It's part of your life insurance, and you pass it on to your family when you pass if you don't use it, right? So again, you may say, oh, I have a whole life. A whole life policies do not carry, you cannot add a long-term long-term care rider to it. So you can only do it, right, with the cash value IUL Index Universal Life Plan. Now, if you are so attached to your whole life, then you can get an independent, a standalone long-term care plan, again, through AIG, Nationwide, Transamerica, John Hancock. But if you don't use it, right, you're gonna lose it. So you pick. Now, who needs a long-term care? If you have aging parents or they're getting close to that age at 45, 50, they are near retirement, if their health is not the best, right? The best time to get it is right now. Because if you wait when they have cancer, heart attack, diabetes, high blood pressure, uncontrollable high blood pressure, they will not be able to qualify. So this holiday season, as you're gathering with your family, you need to have those conversations. Mom, Dad, where you want to spend your last days? Are you going to stay in the house? Are you going to go into a nursing home? So how are we going to pay for it? What kind of plans you have? Do you have enough money to pay for it? The average nursing home long-term care costs anywhere from 10 to 15. That is if you want a 4-star, If you want a 2-star, if you want a 1.5-star nursing home, maybe you'll do like 7. I don't think anything lower than that, right? So just like hotels, you have the nursing homes have ratings, right? You have 5-star, 4-star, right? It's based on their care, their nurses, right? The staff, the environment, how safe it is. So again, you don't just put your mom anywhere. You need to make sure that it is safe, that they have a good rating. And simple Google will give you the nursing home rating. So you do not want to go anywhere below a 3. Anything below a 3 is probably roach infested, care is lacking. So again, if you have aging parents, or if you are advanced in age and you don't have a plan that how your last day is going to be spent, whether it is at home, you can stay at home and get your long-term care. You can go into a nursing home. You can go into independent, right? If you are still independent, you need some reminders. Some people go into independent because they cannot cook by themselves, or they need reminders to take their medicines, right? Or assisted living. Your long-term care plan can pay for your care in those settings. So you don't have to deplete your savings, deplete your retirement, deplete your kids' college fund to pay for your care in the nursing home, right? So again, this is a topic that we don't talk about. Long-term care. What happens to you if your kids cannot keep you at the house, if they cannot care for you? First of all, you have to stop and think, do you really want to put that burden on your kids, having them care for you when you are old, right? Some kids will. I have 2 kids. I know one of them, she told me that she's not putting me in a nursing home, but I have to have my long-term care plan so that I can get nursing coming to the house. What the other one, I'm sure she does, yeah. One of them said, no, mommy, you're not going to a nursing home. But I do not want to put that pressure on her, that financial burden. If you have multiple kids, yeah, they can take turn, but they will get burned out. They probably have their own family to care for, and not have to worry about caring for you. Sleeping over, rotations. Some family do rotations, right? So still, it is okay if you want to stay home, but have a plan that even if it's 4 hours of nursing, that you can relieve your family, right? You can pay for someone to come stay with you, do your laundry, clean the house for you. Yes, your long-term care plan will pay for that. So a lot of people, right, when buying insurance, life insurance, you guys don't know what plans to take. You have three plans. You have term. Term does not give you living benefits, right? Most companies, and the most common company is a death insurance. It's not life insurance, because you have to die for your family to benefit. So that's death insurance. If you get sick, you cannot use it. So you have to review your plan to make sure that you have a plan that gives you living benefits. If you have critical, chronic, terminal illness that you can leverage, right? The elites, the informed, the wealthy, they love to leverage other people's money. You too, you can, but by getting yourself into the right plan. Again, term insurance is death insurance. Some companies will give you some living benefits. They don't have long-term care. So you have to review what you have, right? Again, guys, December, it's the end of the year. It's the perfect time to plan out financially. Go over your finances. You know, if something should happen, if she gets sick, like we have a client just got his insurance last month, less than 6 weeks. Truck driver, right? He had an epileptic episode, drove off the cliff with his truck. Thank God he didn't die. He will never work. Guess what? We were able to get him a plan with living benefits. He doesn't have to worry about where his bills gonna get paid from. We're gonna put a claim for him so that his benefits can be paid. What do you have that if you have one accident that you cannot work, that your income is replaced? Your term, most of you, the term that you have is a death benefit. It's a death insurance. It doesn't pay anything if you get sick. Review what you have. Again, everything that I do is complimentary. I don't charge my clients. So if you're watching this and you don't have a plan that can pay you if you get sick, you need to get with me. I'll review it and see if you can qualify. Now remember, guys, everything has to be, you have to qualify for it. Okay. When they need your money, you don't. But when you're going to use the insurance company's money, you need to qualify. Again, if you don't have a plan, talk to your kids. Who's going to take care of you when you get sick, when you get old? Are you going to stay in the house? If you own your home, is it still on your name? You will not qualify for Medicaid if your house is on your name. If you have more than $2,000 in total assets, you will not qualify for Medicaid. So those are the things that my community need to understand. You can qualify for them, but there are conditions, right? We think that having everything on our name or don't disclose anything to our kids is the way to go. No, take that house off of your name, put it in a trust. That retirement plan, make sure that you have beneficiary. If you have an insurance, life insurance, cash value life insurance, make your trust the owner, because make your trust pay for it. Because when you come in my nursing home and I see that cash value, I see that you're paying for life insurance, I'm going to ask for a copy of it. If it's a cash value policy, yes, you better believe I'm going to ask you to cash it. Otherwise, I cannot qualify you for Medicaid. So you can get your own long-term care independently, use it or lose it. You can have it as a rider on a cash value plan, because that is attached to modern day policies, right? That covers you while you're still alive. We're talking about an insurance that pays you while you're still alive. You don't have to die. So again, I really hope that you guys have a clear understanding of what long-term care is. Long-term care is when you have a condition that lasts more than 90 days where you need, right, assistance to bathe, to eat, to transfer, to toilet, right? If you cannot meet 2 of your 6 activity of daily living, you qualify for long-term care. So you have to think, if you're in a position, again, it's not age driven. We have people 30 years old who are in a nursing home. One accident, they become a quad. They cannot care for themselves, right? So it's not about an age. It's about your condition. Again, I have 25, like 26. I think the youngest patient I had that needed long-term care was 26 years old. It is not a matter of age, of old age. Yes, most of the population that is using long-term care is the elderly, which is about 70% of our population that find themselves in a long-term care facility. How are you going to pay for it? Are you going to put the burden on your family having to care for you? Or you have a plan that can pay for your care, whether you are at home, you can stay in your home and still leverage your long-term care policy, or you can go into a 5-star, right, facility. Again, it's all about how much money you have, what you can afford. So now you need to go ask yourself, okay, how do you have this conversation? It's going to be hard to have this type of conversation with your family, but it is one to have. Otherwise, you have to think, who is the burden going to be on? Is it going to be on you, on your sibling? And is it fair, right? So again, if you are age 40 and up, you need to start thinking about this. If you get sick, if you need long-term care, how are you going to pay for it? Do you have to deplete your 401k, your retirement, your savings? Again, remember, you cannot have no more than $2,000 in total assets in order to qualify for Medicaid. Medicare will not pay for your long-term care. Medicare pays for skilled nursing care, meaning that you have an RN right? Attending to you for so many hours. You're on antibiotics, you have wounds, right? Or you're getting so many hours of physical therapy. That's what qualifies you as a skilled. Medicare has a cap, will not pay for long-term care. So you have to depend on Medicaid, or you can be a responsible individual. Get with me or get with a financial professional that you may know and get your own long-term care plan so that you do not have to be a burden for your family. Getting yourself into the right plan now so that it can take care of you later. Again, making sure that you have the right insurance. We always say, protect your family in private so that you're not embarrassed in public through GoFundMe, right? GoFundMes are not done for weddings, they're not done for birthdays, they are done, right, because of lack of planning, medical illness. Guys, it is within your reach. It's a matter of shifting your mind. Be willing to learn that those plans are available to you. They are not only for the elites. You too can have your own private retirement plan. You can have your own private long-term care plan so that when you do need it, you will have it and not be a burden to the public or to your family. So I've delivered my message. I was challenged because I've never talked about long-term care, but that's how I got in the industry, having worked in the nursing home for 23 years, seeing my clients leveraging life insurance, the right life insurance with the right company to pay for their long-term care. Like, it's like, it was mind-blowing. So I'm going to talk more about it because that's how I got in the industry. Because when I learned about how the informed, they were not necessarily the elites. It's a matter of information. What separate us from the have and not have is information. So that's why I come on here every Monday to provide information to you. So when I found that information that my patients were leveraging life insurance plans to pay for their room and board in the nursing home, I made it my mission, right, to go teach my community because we just don't know what we don't know. So that's why I come on every day, every Monday, right, between 1 and 1:30, just to inform you of those things that are within your reach. Start planning now. Don't wait till you hit 60, 65. That's when you're going to start planning for latter days, right? You can have a beautiful second phase of your life with proper planning. Again, that's all I have for you guys. Thank you all for those who are watching. Please share, like, comment. Let me know what you would like to learn more about. And if I don't know it, I will bring a guest on. So I am looking forward for some more information, to share more information with you guys. Next week, I don't know what the topic going to be. Maybe you can tell me what you want to learn more about. So looking forward to seeing you guys next week. Again, share, like, comment. I need to build my community on Facebook. So those who are watching Facebook, please like, share, comment. I need some engagement from you guys. So I don't want to come in here and just talking to myself and with no engagement from you. Love you guys. Thank you. Be well. Bye-bye. Are we still on Radio Télépuissance? So I said goodbye to my Facebook people. Again, guys, my number is 352-809-9037. 352-809-9037. I am on Facebook. Please go follow me on Facebook as Daniella Noel. On Instagram, I am Daniella Noel. I really want you guys to engage with me. I am building my community on Facebook. So by more people following me, by more people liking my content, the more I'll be able to share. So more people will come on and learn this. So do not keep this information just to yourself. Again, hey, Nobody's coming to save you. You need to set up your own plan. You need to set up your own plan to make sure that your family, right, one illness, you don't end up in chaos. So one illness can really disrupt, right, your whole family settings, your whole family environment. Because when you don't have the proper plans in place, guess what? Your family has to pick up the slacks or even, go to the public. Again, a lot of GoFundMes are done, right? Because people are looking for the public's help because of lack of planning. You, this season, take this time, get with your family and strategize, right? Don't just go spend everything that you have, right, on buying gifts for people who don't care about you with money you don't have. So strategize how you want to live your life in 2026, right? This is the last month of the year. This is not the end. This is your last lap. You still, can set yourself up for a full transformation in 2026. So be brave. Take that decision that you know that you've been delaying. Take the step, right, that will help you start your 2026. Don't wait till January 1st to start 2026. Start it now. Strategize, right? What do you need to put in place? Do you have life insurance? Do you have a trust, right? Do you have college planning for your kids, right? Reach out to someone. Again, everything I do is complimentary for my clients. I don't charge them. So if you have a plan, you don't know what it is exactly, reach out to me. I can walk you through. I can give you financial need analysis. A lot of people, they have insurance, but they have a $30,000, $50,000 life insurance plan. Is that enough? Is that enough to cover your expenses? Not only when you get sick, how about when you die? Do you have kids? Do you have a mortgage? Do you have enough coverage to at least to cover your mortgage? If you have a spouse, what will be the burden that will put on your spouse if you're no longer here? It is hard with two incomes. It's hard, let alone if you're not here, right? So you have to think about those things. What kind of life what kind of life you want your kids to live? What kind of legacy are you leaving, right? So, guys, it's always a pleasure to come on here, to talk to you guys, to share some things with you. Again, you can do this. You have the power. We live in the greatest country, the richest country. So you don't have to be rich to have those things in place. It's a matter of reaching out, get the information you need, get qualified, and put things in place for your family. Protect your family in private so that they are not embarrassed in public. So I see you guys next week. That's all I have for you. And I